Hello, my name is Shawn Curry. I am one of the core faculty members in the Internal Medicine Residency program here at Good Samaritan Hospital. This is Good Samaritan Spotlight, and your questions answered. So question number one, what is an internal medicine residency clinic and who can be seen there? So an internal medicine residency clinic is a primary care clinic which is staffed by internal medicine residents who are graduates from medical school, who hold a medical degree, who provide primary care services for the community in the area. Who can be seen there? Anyone over the age of 18 years or older, up to the time of death, essentially. We see all different kinds of comorbidities and illnesses. Those who are more complex or who internal medicine doctors usually see. So anybody over the age of 18, we welcome to our clinic. Question 2, are resident physicians real doctors? Yes. So all residents who come to our program are graduates from medical school, either hold a degree of doctorate of medicine, doctor of osteopathic medicine, or the equivalent medical degree. Each physician has completed their training and undergraduate medical education and are now moving on to a specialty in internal medicine. Question 3, what is the difference between a resident physician and a medical student? A resident physician is one who has already completed medical school, who holds a medical degree and are now getting their finishing touches or subspecialty or specialty training in internal medicine. A medical student is one still undergoing medical school and medical education prior to receiving their medical degree. Question 4, what types of health concerns can patients see an internal medicine resident physician for? So all different types of medical conditions are seen in our clinic, from diabetes, hypertension, heart failure, atrial fibrillation, obesity, metabolic associated liver disease, a multitude to include neurologic issues. The one big thing about our clinic is we pride ourselves on being able to take care of complex patients in a multitude of different settings. So those who may have subspecialty care through cardiology, gastroenterology, pulmonology, we help kind of tie together a patch point between these subspecialties and hopefully help quarterback all these complexities and coordinate care. Question number 5, can someone use internal medicine residency practice as their primary care provider? Yes. Another aspect of primary care residency practice is that we focus on health maintenance and preventative medicine. We really pride ourselves on taking care of multiple health issues, but also on preventing things from happening. We are able to do Medicare wellness exams, well-woman exams. Preventing things that could cause you heartache down the road is the best medicine we can do, and absolutely the residency clinic to provide good primary care and be a primary care provider. Question 6, what should a new patient expect at their first appointment? Just like any other kind of first or new patient appointment, we really want you to get to know your provider and get to know their background, and so they can know you and your health journey. At this appointment, we'll try to tease out all of your big chronic conditions, medications, and see the best way that we can help move your health forward. Subsequent visits may entertain the ideas of chronic care management, acute care, or other kind of wellness exams. But that first meeting is to kind of outline what you have going on and what medications you're taking. Question number 7, how are patients cared for by both resident physicians and supervising faculty physicians? So every appointment you will see a resident physician, hopefully your primary care physician or one of their, we call them mini clinic mates or colleagues, to help with that continuity. Each appointment, the resident will staff with a supervising attending physician to discuss the plan of care they have set forth for you. Most of the time you will end up seeing an attending physician to come in and just say hi and make sure all the questions are answered. At times with our upper level residents who are about to go into practice, you may not see an attending physician, but rest well knowing that your case has been discussed with an attending physician each time. Question 8, why might a patient choose an internal medicine physician for adult primary care? So internal medicine docs have been known as the doctor's doctor for a long time, and they really pride themselves on complex care and complex patients with multiple health issues going on. Those who get up in age and have multiple things that are happening, internal medicine primary care focuses on how we can tie all these together and make your life easier with complex conditions happening. We also like to think of ourselves as that bridge between subspecialists and also help navigate the aging process. Question number 9, what chronic conditions do internal medicine residents commonly help manage? So a few common processes are things like diabetes and their complications, high blood pressure, high cholesterol, coronary artery disease, someone who has suffered a heart attack, post-stroke syndromes, other neurologic kind of ailments such as Parkinson's disease we can help with, heart failure, multiple musculoskeletal complaints to include osteoarthritis, rheumatoid arthritis, and other autoimmune processes, a variety of skin issues that can be going on. Our practice, we do offer a full scope internal medicine practice where we also do things such as knee injections, skin procedures, shoulder injections, trochanteric bursal injections. We do bedside ultrasound to help us investigate. So a multitude of different conditions in addition to any kind of acute ailment that you may be dealing with. Question number 10, is the Good Samaritan internal medicine residency practice accepting new patients, and how can someone schedule an appointment? Yes, of course. We would love to have you as our patient. You would just have to call up to our clinic, 812-885-6990, and schedule a new patient appointment. We'd be happy to see you for any ailment or at least a consultation to see how we can help better your healthcare needs and how you can help grow our program in internal medicine at Good Samaritan. That was the last question. I'm Dr. Shawn Curry, and this was Good Samaritan Spotlight.